All right, welcome. In this explainer, we're going to break down exactly what's happening inside your body when you get a case of acute viral hepatitis. So let's just dive right in. And to really get this, we first need to talk about the hero of our story, and that is, of course, the liver. And look, this is not just any old organ. Think of it more like a super complex internal chemical processing plant. It's absolutely essential for life, you know? It's doing hundreds of jobs 24/7 without ever complaining. And this is just a beautiful look at the liver's architecture. It's built for maximum efficiency. What you're looking at here are these hexagonal units. They're called lobules. And each one is like its own little mini factory, perfectly set up to process blood and then send out the good stuff, purified blood and bile. I mean, it is a real powerhouse. It makes albumin, that's the protein that keeps fluid inside our blood vessels. It produces most of the factors that, stop us from bleeding. It's also our body's sugar reserve, storing up glucose for when we need a burst of energy. And of course, it's our #1 detox center, breaking down pretty much everything from alcohol to medication. Okay, so with all that in mind, what happens when this incredibly fine-tuned system gets disrupted? What happens when it's under attack? Well, the name really says it all, doesn't it? Hepatitis is just a fancy way of saying an inflamed liver. Now, a lot of things can cause this, toxins, alcohol, but today we're zeroing in on a very specific group of culprits, viruses. Viruses that have one mission, to target and attack our liver cells. Okay, this is what I find so interesting. On this slide, you can literally see the body's immune response in action. See all those dark purple dots? Those are inflammatory cells. That's your body's army, flooding into the liver tissue to fight off the virus. But here's the problem. This battle, it causes a ton of collateral damage, and it ends up injuring the very liver cells it's supposed to be protecting. So, there are a bunch of different hepatitis viruses out there, but for what we're talking about today, we're going to focus on hepatitis B and C. They're two of the big ones. As you can see, they get around in different ways, but they're both notorious for causing not just that initial acute sickness, but also long-term chronic liver disease. So you might be wondering, how does your body even signal that this massive internal battle is going on? And then how do doctors actually confirm what's happening? Well, one of the most classic signs, the one a lot of people know about, is jaundice. That unmistakable yellowing of the skin and the eyes. And listen, this is way more than just a cosmetic change. It is a direct, external sign that the liver is failing to do one of its most important jobs. Okay, so to really get what jaundice is, we have to talk about this stuff called bilirubin. Basically, it's a yellow pigment that's left over when your body breaks down old red blood cells. You can just think of it like cellular garbage that the liver is responsible for taking out. Now, when everything's working right, bilirubin follows this really clear 3-step path. Step 1, it gets created. Step 2, the healthy liver grabs this raw, indirect bilirubin and does its magic, processing it and making it water-soluble, or direct. And then step 3, this newly processed bilirubin gets dumped into our bile and boom, it's eliminated from the body. Simple, clean, efficient. But when the liver is all inflamed because of a viral attack, that absolutely crucial second step, the processing step, it gets blocked. It's like a major traffic jam. The liver cells are either too damaged or just too overwhelmed to do their job. So what happens? All that yellow pigment, it just backs up into the bloodstream. And eventually, it starts getting deposited in the skin and eyes. And that's what causes jaundice. Okay, so jaundice tells us, hey, the liver is in trouble, but it doesn't tell us why. To pinpoint the exact viral bad guy, doctors use a blood test called serology. And you can really think of this like a super sophisticated detective's toolkit. So how does this toolkit work? Well, it's looking for two main clues. Pieces of the actual virus, we call those antigens, and our body's response to the virus, which we call antibodies. So for hepatitis B, for instance, if the surface antigen, the HBsAg, is positive, that means the virus is actively there, right now. But if the surface antibody, the anti-HBs, is positive, that means you're immune. It's an incredibly precise way to figure out exactly what's going on. Now, the good news is a lot of cases of acute viral hepatitis actually resolve on their own. Your body fights it off. But what happens if the inflammation just doesn't go away? What if the battle turns into a long, drawn-out war? Right, and this is where the real long-term danger comes in. Think about it. When you get a cut on your skin, it leaves a scar, right? Well, the same thing happens inside your liver. Chronic, persistent inflammation causes scar tissue to form. We call this fibrosis.
And this process makes the liver, which is normally soft and flexible, become stiff and hard. And that, as you can imagine, seriously messes with its ability to do its job.
Thankfully, and this is really amazing, we have incredible technology now that can measure the scarring without having to do an invasive liver biopsy, something called a fibroscan. It's a type of elastography, and it basically gives us a direct reading of how stiff or scarred the liver has become. And the way it works is based on this fascinatingly simple principle. The device sends a tiny, harmless mechanical pulse, like a little thump, into your liver, and then it measures how fast that wave travels. It's kind of like how sound travels faster through a solid wall than it does through the air. In the same way, these waves travel much faster through stiff, scarred-up liver tissue than they do through healthy, soft tissue. And this is where we really see the power of this measurement. The speed of that wave gets converted into a pressure value, measured in kilopascals. And when that number starts to climb and gets above a certain threshold, usually around 12.5 kilopascals, that's a really strong sign that the scarring has progressed all the way to cirrhosis, which is the most advanced stage of liver disease.
So, all of this really leaves us with a final, crucial thought. Acute viral hepatitis, it isn't always just a brief illness that you get over. For some people, it can be the very beginning of a long and often silent process of liver damage. So, understanding the signs, knowing the risks, and getting answers early, that can make all the difference in the world when it comes to protecting this absolutely vital organ.